Good day. I am John Robert Bautista, and I'm a postdoctoral fellow at the School of Information, the University of Texas at Austin. On behalf of my co-authors, Daniel Harrell, Eric Mayer, Elia Oliveira, and Anjum Khurshid, it is my pleasure to present our study entitled CORES Issues on Blockchain Deployment in Healthcare, Evidence from Experts. Many scholars and industry experts have noted that blockchain has the potential to improve health systems and delivery. It is no wonder that this potential has catalyzed the rise of health-related blockchain research and development, as evidenced by the rise of several blockchain-related companies and publications. At the University of Texas at Austin, we have developed a prototype blockchain-based identity verification and personal health information management application we refer to as MediLinker. This application is a collaborative effort by faculty and staff of the university's Dell Medical School, Department of Electrical and Computer Engineering, School of Information, and Information Technology Services. We developed MediLinker to demonstrate how blockchain can be used to decentralize health information, streamline patient identity management, give patients control over their own data, and streamline consent for research. MediLinker allows patients to store identity within the app through the creation of a health ID by presenting a government-issued identity at the first instance. Once identity is established and stored in blockchain, MediLinker allows patients to check in with clinics by sharing their identity for verification. Besides, MediLinker allows patients to share personal and medical information with clinics, revoke clinics' access to personal and medical data, update personal information, and provide consent to participate in research projects. To our knowledge, MediLinker is at level 4 of the technology readiness level. Last year, we have tested and validated MediLinker in a field laboratory study by testing it with simulated patients who use synthetic medical data. You can read more of our research findings in our 2021 JAMIA Open article entitled Designing and Testing a Blockchain Application for Patient Identity Management in Healthcare. Moving forward, we now plan to move to level 5 by testing and validating MediLinker in clinics around Austin, Texas, using live data from real patients. However, before moving to live clinical testing of MediLinker, there's a need for us to contemplate on potential issues to consider when deploying blockchain technologies in healthcare settings. This is important since health information technologies often have unintended consequences that need to be recognized and, if possible, addressed before deployment. Such an approach recognizes the social-technical nature of deploying blockchain in healthcare, wherein such a technology interacts with social and technical systems that are in place in a given deployment environment. Based on our team's brainstorming sessions and literature review, we have identified 5 areas to categorize issues surrounding blockchain deployment in healthcare. These are clinical, organizational, regulatory, ethical, and social issues. In short, we refer them as CORES issues. To better understand issues associated with blockchain deployment in healthcare, this study aims to reach 2 objectives. First, we aim to identify CORES issues when deploying MediLinker or blockchain in general in healthcare settings. Second, we aim to identify recommendations that could address such issues, guided by the social technical approach in identifying issues related to technology deployment The findings can inform us on several details to consider when designing, developing, and deploying MediLinker in clinical settings. Besides, the findings contribute to a greater understanding of issues surrounding the use of blockchain in healthcare. In order to identify specific issues within CORES, we conducted an expert focus group on March 26, 2021 via Zoom. The experts invited in our study were experts in one of the course areas. Among the 11 experts that attended our focus group, four were assigned in the clinical group, four in the organizational and regulatory group, and three in the ethical and social group. The focus group has three parts. The first part provided by participants with an overview of MediLinker and aims of the study. The second part is a small group discussion where each group identified issues relevant to their expertise. The third part is a large group discussion where all groups were convened to identify potential recommendations based on identified issues. The entire session was video recorded, and the resulting interview transcripts were analyzed qualitatively using thematic analysis. Now, let's proceed with the results of the study. For clinical issues, system level issues include whether MediLinker would be compatible and accessible in a host of devices, such as smartphones, tablet computers, and desktops. Besides, can it be integrated in existing systems of an institution? Moreover, even it can be integrated in the system of one institution, can it be integrated in the system of other institutions, especially when institutions in a city have heterogeneous documentation systems? On the patient side, since MediLinker would need identity documents to establish identity, how can this occur when a person does not have any legal identity document? Besides, digital and e-health literacy were discussed as well as the usability of MediLinker among vulnerable populations. On the clinician side, how can MediLinker be integrated in their existing workflow? Previous work on electronic health records shows that additional features often cause confusion and increase in workload. So it is crucial to seamlessly integrate MediLinker in existing workflow of clinicians. On the administrator side, the participants noted that health administrators may be adamant of adopting blockchain because of legal uncertainty, as it is a new technology. Moreover, some administrators may not be able to commit to time and financial costs associated with deploying such a technology. Some participants also think that institutions have an inherent preference to control data, and deploying a technology that allows patients to take full control of data may be perceived as something that is not in the best interest of the institution. For organizational and regulatory issues, participants outlined the importance of organizational compliance. First, we need to consider compliance with existing laws and regulations that are ever changing. This is more important when the data is dynamic, wherein it is transferred from one institution to another, since state and national laws in data management may differ. Besides, it is important to be mindful of crafting terms and conditions within the software as a legal safeguard. With, while MediLinker provides a mechanism for patients to safely store health information in a blockchain, patients may not voluntarily disclose critical health information that might be needed during emergency situations. Some participants also highlighted the issue of identity, specifically on device, individual, and organizational identity, since these entities may be accountable in different processes involved in using blockchain for help. Finally, since blockchain is relatively new, policymakers are still interpreting existing laws and regulation to determine how to best fit them on existing blockchain works. Consequently, the general public may not also be aware of the legalities involved when healthcare data is stored in blockchain or ethical and social issues. Participants noted that establishing trust is crucial to overcome suspicions of data mismanagement and improve blockchain adoption. This is particularly important among historically oppressed groups. There's also needs to be greater transparency on what blockchain is and how it protects people's data. Experts also pointed out the existence of digital divide in society, wherein some segments of the population may not have access to devices and the internet to properly utilize MediLinker. Finally, we need to think a way to convince institutions to recognize digital autonomy in cases where blockchain is used to digitally execute, approve, and verify consent embedded in documents such as medical power of attorney and advance directives. Currently, these documents require a wet signature on paper, and executing digital autonomy in this space is seen as a challenge in both patients who request them and institutions who will accept them. Based on the identified course issues, we now present recommendations from experts that could address some, if not all, of the course issues. To address clinical issues, there needs to be more user testing among diverse patient populations. Also, we need to design interfaces based on patient preferences. Moreover, we need to present concrete benefits of adopting blockchain to health stakeholders. This may include linking blockchain use with positive health outcomes, as well as financial and time incentives. To address organizational and regulatory issues, experts recommend that we obtain feedback from top management also. To ensure legal protection, there needs to be proper disclaimers and disclosures in terms of the technical aspects of MediLinker, and this needs to be compliant with different standards and regulations. More importantly, we would need to think like a regulator during the development and testing of MediLinker. This will allow us to anticipate whether certain aspects of MediLinker may be violating standards or regulations. To address ethical and social issues, more effort should be geared towards increasing the public's awareness to blockchain. Besides, there is a need to conduct additional testing of use cases that reflect experiences of vulnerable populations like homeless and undocumented people. This will allow us to make MediLinker responsive to the needs of those that are underserved. To conclude, our study showed that blockchain-related issues can be categorized as CORES, and these issues can guide the design, development, and deployment of blockchain-related health applications. Overall, we believe that the issues and recommendations identified in this study will be useful as we move MediLinker from a prototype to a minimum viable product for live clinical testing. Before I end this presentation, I would like to acknowledge the support of the Bullard and Boyvi Fellowships of the UT Austin School of Information and the Blockchain Initiative of the UT Austin McCombs School of Business. For questions or clarifications, you can contact me at jrbautista@utexas.edu. Thank you very much for your attention and have a great day.